based on a wide spectrum of diseases like HSP, nephritis, nutrition and CKD, genetic and workup and metabolic workup on kidney stones. There also works on monogenetic primary SRNS, and then there are also thesis going on with the outcomes of anti-GBM disease in children, vascular access in children with maintenance history. There are also works on quality of life in children with lupus nephritis, and then we are currently involved with indications and modalities of TRT and PICU. So these are some of the things that is going on. There are a wide range of publications in international recognized publications, and they have a good impact factor. You can see from here. There are works on clinical spectrum of children with lupus nephritis in low and middle income countries, an initial report. And then we have progressions of acute kidney injury to chronic kidney injury, a prospective study that was published in pediatric nephrology. The others are disaster preparedness and kidney health in children, and also pediatric kidney replacement therapies in low to middle income countries. So these are some of the publications that is being done in the last 1 year. Then ICH is also involved with publications like next generation nephrology, and there's there are 2 studies on rituximab. Multicentric studies evaluated rituximab therapy in childhood steroid-resistant nephrotic syndrome, and then there was one study which dealt with single dose to double dose of rituximab along with the MMF for children with SDNS, FRNS. This was a multicentric open label RCT. Then there's also we did a few years back, it started and last year it got published. It was an open label randomized RCT on daily compared to alternate A levomethasone. There is also study on ANCA, antibodies in nephrotic syndrome who are treated with levomethasone. It was a cross-sectional study, and symptoms was also published. So there are many presentations from the faculty of Institute of Child Health. Most of the faculties have participated as invited faculties or have presented their papers or posters and has been involved in conducting workshops as well. They have participated in APNA, ASN, WCN, some of them. Our faculties from ICH also participated in national, zonal and state conferences like ISPN, BSPN, Eastern Zone Nephrology, and also West Bengal APNEICON. There have been few accolades and awards that have been won by the team from the ICH. Dr. Deslina, for example, won the first prize for oral presentation on cystic kidney disease. Our current fellow, Dr. Ripa, has won first prize in BSPN oral presentations, first prize in BSPN poster presentations, and also second prize for in Pediatric Rheumatology Society Conference. Dr. Suchesmita, she was an ex-fellow, just passed last year, ISPN Fellowship awardee. Currently involved with a lot of presentations that have been happening. She's a young, dynamic, young pediatric nephrologist. She has presented her papers, oral as well as poster presentation. Also won prizes at CMC Vellore for poster presentations. She has also won first presentations in ISN, Eastern Zone, and also presented few more papers. She's also conducted the workshop on acute peritoneal dialysis. So some of the activities that have been given by us. So Institute of Child Health also celebrate every year World Kidney Day, sorry. And these are some of these snippets and pictures which you can appreciate. And it is widely done every year because we want to create awareness of kidney disease amongst the parents as well as with the other faculty members. We are also sister renal concern as part of the ISN, and we have a sister renal concern from the Birmingham Children's Hospital, UK. As part of the project, we are also involved in promoting more of pediatric nephrology training. Our first hemodialysis update came last year, and it was mainly focused on training the technicians. So we had this hemodialysis update only for the technicians, and it was well attended by almost 40 to 50 technicians who were interested in learning pediatric hemodialysis, which in our part of the country, again, there are few who are expertised in this kind of pediatric hemodialysis. So it was done and it was widely appreciated. Instead of Child Health also had a first ICH update, and it was along with that, it was also collaborated with second nephrogenetic workshop that focused mainly on the cathode. It happened last year in October. So we are also moving towards the social media, and this was launched last year in a big way, and then we are trying to promote more of pediatric nephrology awareness, mainly for parents and also for doctors across. So recently we have had, we are also into Instagram Nephro Nuggets, which is specifically targeting our Institute of Child Health Nephrology department, which deals with a lot of awareness programs and awareness short clippings. So you can follow us whether in YouTube and also in Facebook. Now beyond ICH, there are also pediatric nephrologists working all over West Bengal. They have come together every year for BSPM-CON. So only in June, I guess, yeah, we conducted this BSPM-CON, and it was attended by many of the faculties, even from Odisha and also from Bihar. So these are some of the clippings that I am showing. Meanwhile, Command Hospital also conducted PD workshop, and it was attended by most of us from the West Bengal. Now beyond AIMS Kalyani, I think Dr. Shubhankar is here. So he's been instrumental in conducting his first focus CME that was conducted on AIMS and UR. It was a practical demonstration mainly focusing the focus and also the hands-on training on kidney biopsies category. So it was a very innovative idea of Dr. Shubhankar conducting this a few months back. So this is what has been sent by Dr. Shubhankar. I think it was a hugely successful first attempt from him and his team. So I congratulate, and I hope he continues to do this next year also. Among the upcoming events, I take the opportunity on behalf of my team to invite you all to the third ISM SRC Nephrogenetics update, and also it will be the second ICH Pediatric Nephrology update, which is going to be held next month, that is in October 25th and 26th. You also know that next year Pedicon, that is in 2026, will be in Kolkata. So we are very excited about it. We have some very interesting workshops that will be conducted by the pediatric nephrology team from Bengal and all across. So Northeast is also involved in some very big academic event which they organize every year. So NIGREMS, for example, conducted the last year APNEICON. So Dr. Himesh, I think, is here. Dr. Himesh has been involved in participating in a lot of CMEs dealing with pediatric CKD and transplant. He's moderated a lot of sessions. He's been part of the faculty in PDSI-CON and also presented papers. He's been faculty at BSPM-CON. He has moderated sessions, and he also, under his belt, has got few work which was presented in Patna Congress 2025. So this was from the last year APNEICON that was conducted by Shillong team at NIGREMS. Dr. Deepti Devi, present, she is here. She is also a very senior pediatric nephrologist, among the most senior ones amongst us. And she is actively involved even in promoting pediatric nephrology in northeast part of the country. She is organized World Kidney Day celebrations at KGMP Hospital Guwahati, and has been actively promoting by getting involved with acute PD workshops and other teaching work that is happening in Guwahati Medical College. Now from Odisha, this was sent by Dr. Sugal. I think he is not able to make it this time, but there are interesting research papers that have happened. First, the workshop on pediatric API and PD workshop as part of the Saving Young Lives, which happened last year in November 2024. There are a wide area of research papers that is currently being done, like ocular complications in pediatric patients with nephrotic syndrome, on long-term corticosteroids. There are papers on rituximab, there are papers on the oral methylprednisolone versus prednisolone, a pilot RCT in treating first episode of nephrotic syndrome. There also works on newborns with hyponatremia and its correlation with urinary sodium level, quantifying the proteinuria in spot protein-creatinine ratio and time sample in correlation with 24-hour urine protein sample in idiopathic nephrotic syndrome. The spectrum of SL in children is also being researched. Prevalence of vitamin D deficiency in children with different stages of CKD. Risk factors of acute kidney injury in sick neonates, and there are also a few more projects that is being going on. So Thank you all. This is all from my side. And once again, I thank the organizing team for conducting such a wonderful academic evening and so interactive we have been throughout the evening. Thank you so much, and also to the audience. And we are basically expecting more and more young nephrologists to join this group from the eastern part of India, to have more and more collaborative effort. And that will make the more and more publication and research in future. And we have people like from AIMS, we have Sir Pankaj Sir. I think for any help, he'll be happy to collaborate with us and help us in every way for any research project as well. So thank you everybody. Thank you and have a good evening.
Thank you, Dr. Sakil. And we will break for tea for some time, and we will start then the inaugural function. I request everyone to be present for the inaugural function, and we prepare the things for the inaugural. I will request everyone to please break for the tea. And again, thank you all the organizing committee members, Dr. Harshvardhan, Dr. Gopal Prasad sir, and everyone. Thank you.
ठीक है वो कुछ नहीं है भाई, सुनिए ना।
कुछ कर नहीं है।
चिकन मछली तो है, चिकन तो है ही नहीं, नदी में मिलेगी उससे बाद मछली खिलाए, इसको तो खिलाए हम आते नहीं,
वो एक नहीं आ रही, तो सागर आएगा, वो बात हो गया, सागर आ रहा है, दूसरे नहीं आ रहा है, बात कंफर्म है, एक ही आ
किए हुए हैं। नहीं है बात तो जरा गंभीरता से लीजिए, इनसे प्रैक्टिस करते करते नहीं मर जाएगी। नहीं करते करते जाना वो मर गए ना, प्रैक्टिस करते करते।
कल हो जाएगा।
नीचे के लिए उठा लेगा स्किपिंग ले बहुत ज़्यादा लग रहा है हाथ मिलाना मना है, भी नहीं मिलना है। किसी से हाथ मिलाना है अरे बहुत ठंडा लगा भाई, जल्दी कीजिए आपको। पटना बनाना है, रशिया पकाने लगे हुए हो, अभी को नहीं पता बनाई। आपको पहला क्लास में वो तो मैट्रिक पास कर गया।
Evening to all of you. After a wonderful evening session full of academic and learning, so we move ahead for the inaugural function. And we are blessed to have Professor APNEICON sir as our chief guest. So I would request Sir, Professor APNEICON sir to kindly come on. Now I would request Professor Kumar sir. Sir is a Padma Shri awardee, currently President of AIIMS Gorakhpur. He has held the post of Professor and Head Department of Nephrology at AIIMS Patna, PMCH Patna, and he has been Director of Patna Road Hospital. Now I request Professor Deepti Devi Madam, who is the President of APNEI, please come on class. Now I would like to request Professor Pankaj Hari, who is the Professor and Head Department of Pediatrics at AIIMS New Delhi. He is the Chairperson Guidelines Committee of IPNA and Chairperson Academic Committee of ISPA. Now I would like to request Professor Nigam Prakash Rai, who is the President-elect of Bihar IIM. Sir, please. now I'd like to request Professor Kumar sir, who is the head Department of Neurology, IEMS Patna, and Dean Academics, IEMS Patna. So now I would like to request Dr. Rajiv Sinha, sir, who is the professor at the Department of Pediatric Nephrology at IEMS Kolkata. Sir. I would also like to request Professor Gopal Prasad, Professor and Head Department of Nephrology, Patna Medical College, Patna, and the organizing secretary. I would also like to request Professor U.S. Rai sir, Senior Consultant Nephrology, Patna, to please. Now I would like to request our junior residents, Dr. Nandini, Dr. Shreya, and Dr. Kritika, to please present the bouquet to our guests. So as a customary, we must remember Goddess Saraswati before any auspicious program is begun, and I would like the dignitary to proceed for lighting of the lamp. Very good. I would also like to request Dr. Shakil to please join us on stage. Now I would like to request Professor Hemant Kumar to preside over the function. Good evening, everybody.
Great pediatric nephrologist like Professor Rajiv Sinha. I am very happy that Dr. Pankaj Hari, Professor and Head Department of Pediatric Nephrology AIMS, has graced this, and as he was telling that he is coming to Patna after 20 years. And our director was telling him that you should come to this place more frequently. So the director IGIMS has offered him or requested him to come as a orator institute for the institute oration in 2026, and he has kindly accepted to be the chief orator on the institute day. All the dignitaries on the dais, all of you know, and off the dais, Professor O.P. Mishra, Dr. Raja Ramchandran, you all have witnessed his brilliance while he was discussing the biomarkers in glomerular disease and how much enthusiasm and interaction it has generated among all the delegates or participants of this. My friend Dr. Jain Prakash, Head Department of Pediatrics, IGIMS, is also here. And I welcome all the delegates, all the students, PG students, to this conference of APNEICON-2025. Organizing this event has been a journey of passion and teamwork. I extend my heartfelt thanks to Professor Hemant Kumar, the Padma Shri awarded by President of India, and the President of AIIMS Gorakhpur, our President, for his unwavering leadership and vision. Dr. Gopal Prasad, our Organizing Secretary, for this meticulous planning and curating an outstanding scientific program. Dr. Harshvardhan, Chairman of Scientific Committee, for curating an outstanding scientific program. The APNI executives, patrons, faculty, volunteers whose dedication has made this conference possible. A special mention to our invited speakers and panelists from across the country who have traveled to Patna to share their knowledge and enrich our understanding. This year's program promises high-quality academic content. Day 1 focuses on pediatric CKD and renal replacement therapy, a comprehensive overview of evolving guidelines, challenges, and innovation. We have already heard a very good lecture by Darshan. Day 2 brings an exciting blend of symposia, plenary lectures, panel discussion, paper presentation, and even a quiz to keep the session engaging and interactive. I encourage all the participants to make the most of this platform to learn, to discuss, and forge collaborations that will shape the future of pediatric nephrology in this region. As clinicians, teachers, and researchers, we share a collective responsibility to bring hope and healing to children and families affected by kidney diseases. I am confident that the insight gained here will translate into a better care, better outcome, and bright futures. Let us use this conference not just to learn, but to inspire one another and reaffirm our shared opinion. On behalf of the organizing team, I once again welcome you all to this APNEICON 2025 and wish you 2 days of enriching academic exchange and warm fellow feeling. Thank you very much.
Thank you. Now I would like to request Professor Nigam Prakash Narayan sir to say a few words.
Thank you very much for inviting me. Distinguished guests present on this occasion of Association of Pediatric Nephrologists of Eastern India Conference 25, Chief Guest Dr. Binde, and the President of this organizing committee, Dr. Hemant Kumar, Padma Shri Dr. Hemant, and the rest of the dignitaries on the dais and dignitaries off the dais. In fact, it's a great opportunity to have been invited in this conference as a president-elect of IAP. In fact, this Association of Pediatric Nephrologists, I think it's a super specialty, but we should understand that the base is pediatrics, and the Indian Academy of Pediatrics is equally involved in all these situations. And I was very happy to see Dr. Chandan, our faculty of PMCH, comparing the show. And I'm sure that most of the PGs who are present here must be taking advantage of this great conference. I mean, as you see, we have seen the subjects so well crafted. I mean, I congratulate Dr. Harshvardhan, the scientific committee chairman, and people who have really crafted this CME so well that it involves most of the subjects, and especially, you see, it's catering to the usual general pediatricians, because most of the cases they come to general pediatrician first, and there should be a level where they should be transferred to the super specialists like pediatric nephrologists. And you'll be very happy to know that we deal with most of the cases of either it is nephrotic syndrome or UTI, or even some, you see, renal decompensation out of the usual, you see, sepsis and the diarrhea, dehydration, wherever it is, or even the chronic kidney disease, they come to us first. And we should have a level where which we should really transfer the cases properly to the super specialist, the pediatric nephrologists. And I'm sure that most of the PGs who are attending this show will gather a lot of scientific contents. The academic, I mean, the content of this CME is immense, and it's so well crafted. I'm sure that you will get the best out of it. Thank you very much for inviting. I'm sure that I'm going to tell you that the whole IAP people, I think I should have invited most of them, and they should have got registered had I got the opportunity a little earlier. I'm sure that most of them are here, but a large portion who will be not attending, I think they should go on to the YouTube. They can join live. I've just seen that, you see, QR code, and that's very wonderful. I think you can spread it out. Whoever are not attending, they can just join through this QR code, and they can attend the lively performance live. That's my preaching to all of you who are not there. You can spread it to your friends. They should take advantage of this very great academic event. Thank you very much indeed for inviting me.
Here today in front of you all, the August gathering. It is my opportunity, and I am very grateful to you all as I am here today to address you. I have seen lots of people here. All the invitees are here, our guest is here, and I have seen different strata of people. Whoever has come, that everybody is having a common goal. We are going to serve the kidney. Maybe it is adult or it is childhood. So whatever is our goal, we are having amongst us a common motto. So that is a great thing. We are united. When there is unity, there is prosperity. And from pediatricians, from pediatric students, I have seen adult nephrologists, they are having a good collaboration, good brotherhood amongst everybody. This is a very good sign, and I think it should be an ideal for everywhere amongst India. Not only I have seen this scenario, this ambience here only. So it should be there in everywhere. So there is cooperation, there is brotherhood, there is unitedness in everywhere with everybody to come to an outcome of serving our kidneys, to protect the kidneys from birth onwards to their whole life. So thank you for giving me to observe me this opportunity here. I have seen they are doing great job all the nephrologists are coming here to cooperate with us. So it is a great thing. I congratulate you all for having this scenario here. Thank you all. Good night.
Thank you, ma'am. I'd like to request Professor Pankaj Hari sir to say a few words.
And it's very heartening to see the pediatric nephrology thriving in the eastern part of the country. I know there are pediatric nephrologists, they were always there in Bengal, Dr. Deepti Devi in Assam, and similarly these are two unique regional societies working in collaboration with the Indian Society of Pediatric Nephrology, and I'm sure they're achieving the goal of for a wonderful job. They have done a very well-designed program, which I witnessed today, the first half, and I'm sure it's going to be even more.
Now I would like to request sir to say a few words.
Committee, it was our job to draft a program that would be useful for the pediatric nephrology community. That because he has been very aptly, I'm not sure how many of you were there, but when he was introduced this afternoon. A person who is very knowledgeable but at the same time very approachable. So it was really, I'd like to thank him for
being a pediatric surgeon, our 60% of workload belongs to pediatric urology. And if you say, and we end up, most of the time, 30% we're dealing with the obstetric uropathy, we end up with in this stage. 10 to 20% we are dealing with regulatory reflux, megavolate in the form of UTI, the different recommendations are there. We have grown up with a different protocol, how to treat, how to start a small kids, a small female child, a male child, how to have protocol. Everything you have seen it. The specialization is not there to monopolize anything. A specialization is there to set the standard. Being a pediatric nephrologist doesn't mean that they have everything under their belt and they will do everything for pediatric patients. They have to, and they have given the light and shown the way how the pediatric kidney should be preserved. Thank and kudos to all the members who are sitting here on the dais for this cause they are doing. As a pediatric surgeon, I have seen many of the kidney, many of the nephrologic problems, many of the obstructive uropathy, whether it is in a neonate or infant, they have been taken care of. And it is not the bread and butter, and it is not the cup of tea of adult nephrology. Because they are not very conversant with the problem what pediatric patients have. Their problem is not only unique, that is also very, very specific, and they have the basics during the developmental phase, most of it, whether it is with obstructive uropathy, refluxes, everything has problem when the developmental stage. And that is the area where the need of specialization is there. Pediatric nephrology, we have nephrology, and we're discussing with the health department and Dean Academics of IIM Patna. We should start the course of the pediatric nephrology DM course. And we are, at the same time, pediatric endocrinology. There are two things we are looking for, and we are going to start. And I will do everything for getting this course started. All the delegates who are here just have the collaboration, networking. You can have everything in this era of AI, but you cannot have the interaction with the stalwart sitting on the dais and off the dais and talking about how the things they have done and how the things are going. So collaboration, networking, and sharing the experiences, these three things cannot be taken away from the physical interaction than going with the advanced electronic or AI or many other things which are coming in the future. So this is one thing. I wish all the best, and I thank you for the organizers organizing such a nice conference. And I am overwhelmed by seeing the whole house is full in the evening hour of Saturday. This is something that's not. Thank you very much.
Thank you, sir. So now I would go ahead with presentation and felicitations. So I would like to request Professor Pratpal Singh to please present a memento to Professor Vindya Kumar Singh.
इसीलिए सर उसको बुलाया
Dr. Vijay Shankar to kindly do the honors. I would like you to felicitate Professor Hemant Kumar Singh. Now I request Dr. Rajaram Yadav, Assistant Professor, Department of Nephrology, Patna Medical College, to kindly felicitate Professor Deepti Devi. Now I would like to request Dr. Majibullah Ansari, Assistant Professor of Nephrology, Patna Medical College, to kindly felicitate the sharing. Now I would like to request Dr. Satya Mohan, Assistant Professor, Department of Medical College, to kindly felicitate. Now I would like to request Dr. Anand Gupta, Additional Professor, Department of Pediatrics, IGMS Patna, to felicitate Dr. Rajiv Sinha. Rishi Kishore, to please come and felicitate Professor Gopal Prashad sir. I would like to request Dr. Amit, IGMS Patna, to give his Now there are few eminent dignitaries amongst us who are sitting off the dais, so I would like to request Professor Binde Kumar sir to please felicitate Professor Vinod Singh sir, former head Department of Nephrology at Patna Medical College. Now I would like to request to felicitate Dr. N.C. Prashad sir, former Director-in-Chief Health, Government of Bihar. would like to request Professor Pankaj Hansal. He is a professor, Department of Medicine, Patna Medical College, and a senior nephrologist from Patna. Now, Professor N.P. Narayan sir to felicitate Professor Jayan Prakash sir, Head Department of Pediatrics, IGM. Last but not the least, I would like to request Professor Pankaj Hari sir to felicitate Professor Amresh Krishna, HOD Nephrology, AIMS Patna.
He goes to felicitate, I will give an example and a virtue of Dr. Pankaj Hari. We had just a chat. He is into professional badminton player. You see, that is a wonderful I am an amateur tennis player, but of course I have been a winner of my youth national. He is into the national level badminton. I am really impressed by his physical capacity. Thank you.
Thank you, sir. And now I would like to request Professor Gopal Prasad sir for a vote of thanks.
First of all, I would like to call Professor Pankaj Hans to felicitate Dr. Harshvardhan. He is the master for the ceremony. Now we come to an end of the program. I have to give my vote of thanks. First of all, I am thankful to all these who have come over here, who are present over the dais, as well as those dignitaries, as well as faculties who are off the dais. And I am especially thankful to Professor Bilbe, who picked up my phone a few days back in very lighter mood. And I was not expecting that he will be so much prompt in picking up my phone. And he accepted instantaneously that I will be definitely coming to the program. So I am especially thankful to you, Professor Binde. And I am also thankful to all the staff, my JRs and SRs, as well as my assistant professors who are present in the hall. And I am also thankful to the pharmaceutical companies as well as for their active cooperation. And I am also thankful to the media person. Probably they are coming, they are on the way. Thanks everyone.
So thank you, sir. So I would like to request all of you to please stand up for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you, sir, and please don't leave because the delicious for you all.
For the APNEI members, like who are members of the Association of Pediatric Nephrology Eastern India, Sumantra, selfie baad mein karna. We have to go to the other room for the GB meeting. Side room of the restaurant for the GB meeting.
अभी फिर नहीं आ रहा है.
यहाँ से
समय आ गया था बाहर से आ जाए उन लोग का तुरंत
उस समय तो है फोटो